Hello, my name is Ashley Mesa, and today I will be presenting on Children's Apperception Test, also commonly known as CAT. This tool is widely used in child psychology to help us understand what children might struggle to express in words. Peering into a child's inner world, imagine asking a 5-year-old to tell stories about animals in pictures and uncovering their deepest fears, hopes, and conflicts. Children often can articulate internal struggles directly, and the cat offers a gentle, projective way to explore their emotional world. For example, if you show a child a picture of two animals sitting at a table and you ask them what's happening here, you can suddenly hear a story about a lonely bear whose parents never listen, or a bunny afraid to go to school. This is the power of cat. Children often reveal their feelings, fears, and family dynamics through storytelling long before they're able to explain them directly. This is why this measure is meaningful to me. It gives children a safe, playful, and direct way to communicate what's going on inside their minds or inside their homes. What is CAT? CAT is a widely used projective thematic personality test for children aged 3 to 10, which analyzes the stories that children tell about pictures. It is used to identify and diagnose personality and emotional disorders in children. It is also designed to elicit information about children's perception and imagination to help understand their conscious and unconscious minds, motives, attitudes, emotion, and conflicts. There are three types of tests: CAT A, CAT H, and CAT S. CAT A is also known as the original one. It uses animal figures in human-like situations. CAT H uses human figurines, and CAT S uses family scenes like illnesses or family separation. All these assess personality traits, emotional conflicts, defenses, level of maturity, drive regulation, and autonomy. Demographics. Who is typically assessed? Like mentioned before, children ages 3 to 10 are being assessed. CAT A is usually used for younger children who may relate more with animals, and they're typically around the ages 3 to 7. And CAT H is usually used for older children whom animal pictures may seem too childish, and they're typically around the ages 7 to 10. Clinically versus non-clinically. They're usually used in clinical settings like child psychology and psychiatry as part of a broader assessment. Administration and scoring. The usual procedure for a cat would be showing one card at a time, allowing the child to tell a story, asking them what's happening, what's going on now, before and after, what the character feels, and things. Recording. When it comes to them telling the story, you record everything verbatim, whether it is you voice record them or you write everything down. When it comes to scoring, there isn't really a right answer to their stories. More so, the examiner sets a standard or a structured scoring system for them to use when going back through the stories. Variables that should be considered would be the major themes, needs, anxieties, conflicts, conception of the external world. The study I'm going to be focusing on would be by a journalist published in 2005. The study is called the Children's Apperception Test Evaluation Forum Initial Data. The participants were 70 children ages 4 to 10, all from Italian schools. They all were tested individually with 10 CAT cards. The study aimed to provide initial empirical data for a new scoring system for the CAT based on psychoanalytic concepts. The researchers scored children's stories using 4 formal indexes, being the number of words, the correctly identifying, modifying characters, and attributions. Also, the types of psychodynamic conflicts, the types of conflicts being unidentified, avoidant, poorly resolved, and well resolved. For reliability, the study demonstrated strong reliability and reasonable preliminary validity. For CAT, it was an inter-rater reliability. The inter-rater reliability was high across all formal scoring indexes and conflict types ratings. Like, for example, formal index, the agreement was 0.85 through 0.98, and the conflicts types agreement was between 0.85 and 0.88, all indicating that different examiners produce consistent results when scoring with using the scoring system. For validity was supported indirectly. Developmental patterns appeared as expected, with older children showing more accurate character identification, richer descriptions, and more well-resolved conflicts. These findings align with theoretical predictions supporting construct and content validity. However, the study did not include external comparison measures, so criterion validity remains untested. When it came to the study's strength, it was a non-threatening, child-friendly format. It is rich in qualitative data, which gives insight in internal world conflicts and defenses. It is also a very flexible measure. It, like mentioned before, is used in a clinical setting, but can also be used in a school and therapeutic setting. Some of the limitations are that it is poor standardized, which means that it lacks in well-established norms. It also is limited with liability concerns, especially when it comes to test and retest. Validity depends heavily on the clinician's interpretive skill, and interpretation may be influenced by the examiner's and cultural bias. In conclusion, I do believe that the CAT is a useful measure, especially as a qualitative, clinically oriented tool. It excels in generating rich ideographic data about a child's emotional life and relational themes. However, it is not a good measure in the psychometric sense. I believe it should not be used in isolation for diagnosis. I believe it's best practice alongside other assessment tools like behavioral measures, interviews, and standardized tests to provide an overall diagnosis. I would recommend it for clinical work, and I do believe it is a valuable measure for research or high stakes decision making. But again, I would be cautious and I would supplement more normative measures because, again, should not be used to diagnose alone. Thank you.